people who have diabetes make up to 180 extra decisions in a day. We are talking right now, but at the back of my mind, I'm thinking, what is my blood sugar? Is it too low? Is it too high? My name is Nupur. I live with type 1 diabetes since childhood, and I live in India. I run the Blue Circle Diabetes Foundation, which is a patient-led organization for people with all types of diabetes. I'm also associated with the NCD Alliance and the Healthy India Alliance. I was 8 years old, and I would go to the washroom a lot. I would drink a lot of water. I was very, very hungry all the time. I was eating more food than my father, but I was also losing a lot of weight. So I had all of the symptoms, of type 1 diabetes, except that we didn't know this is type 1 diabetes. But luckily for me, I was diagnosed in time.
I absolutely hated pricking my fingers to check my blood sugar. My doctor said if you want to attend your dance classes, you have to check your sugars on a glucometer at least 6 to 7 times a day. My name is Snehal. I live with type 1 diabetes since the past 22 years. I volunteer at Blue Circle Diabetes Foundation, which is a registered NGO here in India. I always say that I was lucky that I was diagnosed at the right time with the right doctor. But I know a lot of people that I meet working with the NGO are not as lucky, and they're often misdiagnosed or diagnosed at a very later stage with complications. Our vision is to reduce these cases to zero in the coming years, and that is a message that I want to carry forward at a global level.
Immediately after diagnosis, my world changed. Suddenly, I had to take 4 or 5 injections a day. I had to check my blood sugar on a glucometer 7 or 8 times a day. I had to measure each thing I eat, a piece of bread, a piece of fruit. Everything has to be calculated.
When I was diagnosed with type 1 diabetes, the only thing that my parents and I had to hear from relatives or friends were, will she be able to get married in the future? In the community, we have a lot of couples who are type 1 and married. And the female, she has to manage her own diabetes, she has to manage her husband's diabetes. Along with that, she's also required to take care of the family, she's also required to take care of her job. And all of these things definitely impact you emotionally at some point of time. And I personally feel that therapy or counseling is very important, especially for women who are living with this condition.
Often the health system is burdened, and doctors and patients can spend, maybe 5 minutes, 10 minutes together. But people have hundreds of questions, right? And sometimes there's a cultural barrier. Sometimes they don't have the money. But there are small things that they can learn from a peer support community like ours.
We firmly believe in health for all, and especially when it comes to diabetes, we firmly believe in insulin for all, not only in the urban setting, but in low resource settings like the rural areas. Diabetes, especially type 1 diabetes, is an expensive disease to have. More than half of the salary of a person is going into managing a chronic condition that requires 24/7 attention and support, as well as the financial aspect.
Health is a human right, and without health is nothing. For marginalized communities, the challenges are many. It's not just money, but it's also mentoring. We help them with medicines or with glucometers, needles or pens, but we also help them with somebody who's like an elder sister who can sort of help them and make them understand and teach them about the condition that they're living with.
मेरा नाम तनीषा है। मुझे डांस करना बहुत पसंद है और मुझे 2015 में डायबिटीज़ हुआ था। तब मेरी तबीयत बहुत ख़राब हो गई थी, तब फिर मेरी मम्मी ने मुझे हैंडल किया था।
जब इंद्रानी दीदी हमको जुड़ी, वो 3-4 बार, जब भी इंजेक्शन लगाने के टाइम, जब भी शुगर चेक करने के टाइम, जब भी खाना खाने के टाइम कॉल करती थी कि अभी नाश्ते में क्या बनाए, नाश्ता क्या करा रहे, शुगर कितना आया, खाने में क्या दे रहे, कितना इंसुलिन लगाए, ऐसा बता के अभी तब इसका शुगर लेवल पे आ गया था।
तो फर्स्ट चेंजेस आए कि उन्होंने मुझे समझाया कि अगर मैं ज़्यादा मीठा खाऊंगी तो मेरे साथ क्या होएगा, और मतलब मैं खाना ही ना खाऊँ, खाना ज़्यादा खा लूँ तो क्या होएगा। फिर उसके बाद उन्होंने मुझे बहुत सारी हेल्प्स की, मुझे मतलब दवाई दी, क्योंकि दवाई डॉक्टर पूरी नहीं देते थे हमें, ऐसा 2-2 महीने का देते थे।
अभी तो ब्लू सर्कल से जुड़ने के बाद बहुत समझ में आया हमको।
Blue Circle Diabetes Foundation is a people-led movement, and everything that's done by the foundation is done by people who actually live with diabetes. The role of community is basically to bring people together, to tell them that you're not alone, this is okay, we can all do this together.
As a community leader, it is my job to make the unheard voices of the community to reach key stakeholders and government authorities so that whenever they are implementing these initiatives and making policies for people living with type 1 diabetes or NCDs in general, our voices are there at the table and our voices are heard.
We are in this for the long run. It's not a 100-meter race, it's a marathon.